I think. See? We are live. Don't answer. Share again. So you can hear. I'm posting it to the video. Let's do it again.
I'm asking you to.
Do you want me to send it to the residents?
I'm just making sure that we're about to go live in a sec.
So it's slightly delayed.
About 15 seconds away.
So I'll slow everything I say down, which is maybe helpful for people.
No. It's not like this on Westpac. It's because of that VDI. The delay is extra time.
Should we take that away?
Thank you. So when you're ready, you can say
Yeah, whenever you're ready.
at 10 o'clock.
Yeah.
So good morning, everybody. Thank you for joining us. This is a bit surreal. Normally we have coffee mornings across the church and the practice. We have people coming in. I think things have been changing at such a fast pace for both the practice and our patients and the staff here. We were keen not to have an opportunity where we communicate with our patients and talk to them. So we've reverted to using technology, which a lot of us have had to do in the last few weeks. So this is welcome to the Horgan Health virtual patient coffee morning. Really grateful to people who can join us. Those who are already on, thank you for joining. And if you can pass on the details of this to any other colleagues who may want to join us virtually, please do so. I think that's probably the key statement. What we were keen to do in this is, so I'm Dr. Masood Nazir, I'm the managing partner at Horgan Health. I've got Dr. Anne Cartmill with me, one of the other partners at the practice, and I think between us what we're hoping to try and do is share with you some of the things that have been happening in the recent weeks, plus also answer some questions. And I think at this moment in time there'll be a lot going on, a lot of people worried and anxious about how things are changing on a daily basis. So we're hoping, if nothing else, to be able to answer some of your questions. We've got the team with us in this room, and what they'll be doing is picking up any questions that you have on the Facebook page, presenting them to Dr. Cartman and myself, and we'll do our best to answer them. I'm hoping that actually the team will signal to me that actually everything so far seems to be going okay, and we've got questions and answers, questions coming in. Yeah.
No questions as yet.
No questions as yet, but people saying that they're on, and I think the numbers are slowly going up, which is good. So people out there are joining us. Most importantly, I think it's worth saying, if I know Dr. Cartman is always very articulate, but I can sometimes get a bit too enthusiastic and speak too fast. So please, like you do with the coffee mornings, and people who do join the coffee mornings, happily ask me to slow down, and I'm happy to repeat anything if that would help in any way. So this is Friday the 20th of March. It's just after 10 o'clock. We're in the building at Horgan Health. It's strange to be at the practice with the waiting room not full of patients, compared to 2 weeks ago when it was completely different. I think it's worth us being aware of that. We will talk between Dr. Cartman and myself about some of the things that have changed in the space of the last week and the reasons why we've had to change them, because I think it's really important to reassure patients that we're still committed to doing everything possible for their safety, to make sure that they get the care they need to receive, albeit in a very different way to what we might have done a few weeks ago. Okay so far? Making sure people are on and okay? Fine. So I think the critical things, and I'll start with this, is people are aware that we are now in a pandemic state of the coronavirus. This is a virus that can affect anybody at all. It is for some people, it's worth something like a very severe case, flu virus, but unfortunately in vulnerable patients it can have a very major impact on their general health, and in some cases it will cause people to end up being admitted to hospital because it affects their lungs and their airways. I think the most important thing in this is a lot of people may get this and it may just be something that they feel like they've had a cold and they get better, and the majority of people will do that. What we're trying to do in this case is protect the people who actually would severely impact, and the only way to do that is to stop the amount of contact and people coming together in places and then passing it on, because that's the transmission rate. Transmission of this is much faster than other viruses that we've had in the past. So as a practice, and along with, and we're not on our own in this, all practices across the country, and not just this country, across probably the world, probably when I look at this, are having to respond to this in terms of how can we protect our patients, our foremost thought, but also our staff, because actually we need the staff to be able to run this service. And one of the challenges we've got at the moment is how do you do that when actually for such a long time we've always practiced with patients coming to the practice, making contact with us giving them appointments, seeing them face to face, moving to a world where actually we are saying to people, if you have symptoms like this, there's a good chance you'll recover, and what you need to do is stay at home. You need to identify you've got these symptoms, not worry, you will get better, stay at home. But please contact us if there's anything you're worried about, and in terms of which isn't related to this virus, and we will do our best to reassure you.
So we have our first question from John Myat.
Yeah.
He's asked if we can still hand in repeat prescriptions to the practice as they're unable to log in.
So I think it's really important to try and address these questions as we go along. The best way to do that, John, if you haven't got an online account, and first of all, if you can help you get an online account, we will do that, because we do want to make your life easy. And so please, let us know if you can help in any way to do that. If you haven't, then there's a post box at the front door, at which point you can come in and hand in your prescription, post the prescription in. We'll process it for you. What I will say to you, John, is that what will happen is that instead of the prescription being made available for you to collect once it's been processed, we will send it directly to your pharmacy for you to pick up from there.
Can I just add that if you haven't already nominated a pharmacy for your prescription to go to electronically, we are requesting that at this point in time you nominate a pharmacy. If you choose not to do that, then we will nominate the pharmacy within the building and send the prescription electronically to them. The purpose of this is to minimise the number of individuals coming through the surgery, so that we try and maintain the surgery as safe an environment as possible for those that we need to see.
Okay, so we're looking at other questions on here. So I apologise for looking away from the screen. Just so you're aware, I'm looking at the board here, so it tells me what sort of questions we've got. And thank you for other colleagues on this who are helping respond to some of the questions.
So we've got a question from Susan Arnott. Will routine diabetic and warfarin appointments still go ahead?
Andrew?
Certainly, warfarin appointments will still go ahead, because we do need to continue to do the monitoring blood tests to ensure your safety. The same applies to individuals who are on high-risk drugs who need regular monitoring. For our patients with diabetes, we are, as much as possible, doing reviews over the phone rather than face-to-face, again with a view to your safety. And we will advise on the frequency of monitoring bloods based on the diabetes control that we're aware of and the individual symptoms following their review. But obviously, if somebody has concerns in the interim, then they should contact the surgery by phone or online with their query, and we will do our best to respond to it.
Thank you, Dr. Hartnell. I think it's really important that what we're trying to do with this is maintain the routine care. We don't want our patients to become unwell as a result of not being able to receive a routine care, so we're having to prioritise it, but we're only asking you to come to the surgery where it's absolutely essential for you to attend, where we can communicate with you remotely and contact you either by telephone or video. And we are starting to do more video consultations, and useful for some patients. We are using that as a mode to communicate, contact you and consult with you, so we can make sure your routine care continues. Next
We
question.
have a question from Dawn Fleming. How long will it take before prescriptions will be ready? I appreciate you must be really busy.
So thank you for that, Dawn, and it's a really good question, Dawn. So we are prioritising making sure that the clinicians look at the prescription requests that come in, and unless there's a good reason for your prescription not to be processed within 48 hours, we are doing it as quickly as possible. The challenge that I've heard about is because the volume has suddenly gone up, people are worrying about being able to get their prescriptions. Even once we've done it, patients getting their prescription from their pharmacy is a challenge because the pharmacy's workload has gone up. We are asking people to stick to their routine request cycles and not to request things too early and worry that they won't be able to get things. If you all maintain the way we've done things in the past and request routinely like we've always done, unless of course there's a need for an urgent supply of medication, then actually what we can do is maintain both the service from the practice to turn the prescriptions around, and equally the pharmacies can maintain their way of getting the prescriptions to you.
I mean, everything that Dr. Nazir has said in terms of us trying to maintain our 48-hour turnaround still applies. The challenge comes when people are then asking for items that aren't on their regular repeat list of medications, and that will take longer because it requires the clinician to make sure that it is safe and appropriate for those items to be prescribed for the individual. So if you are requesting items that aren't on your regular repeat, there will be a longer delay. The other issue that it's important, I think, to make people aware of is that for people on regular medication, what we are going to be doing going forward is trying to issue post-dated prescriptions or use repeat dispensing, so that for the next 4 to 6 months, for individuals where it is possible to do this, we are going to be using post-dated prescriptions so that you won't need to come into the surgery in order to request your prescription. We will endeavour to send the prescriptions directly, electronically, to the pharmacy, and so when you're running low on your medication, you should then be able to go to the pharmacy and they should then have the supply available for you when it would be due. Now, for the individuals that we are providing or attempting to do that for, we will try to send you a message that that is what has happened, either through the text messaging service that we've introduced recently, or where that isn't possible, by sending a message through to the pharmacist. So when you go to pick up your prescription, it is worth asking the pharmacist if there are any messages that the surgery have asked them to pass on to you.
So I think, just building on what Dr. Cartmell said, and it's really important, there are a couple of things in that which I'm really keen that we emphasise. One is really if you could make sure all our patients endeavour to make sure that we have their right contact details, both their phone numbers and their email addresses. It will help us, because actually we're really keen to communicate to you in a timely manner. If you do have any concerns about want to turn your prescriptions around quickly, we will contact you and explain why, which is really important. The second thing is, I would encourage you to, if your pharmacy that you use has the ability for you to sign up to a text message reminder service or a prompt service which says, we will text you to let you know your prescription is ready for you to collect, I would encourage you to do that. That will save you having to have a wasted journey to go and pick things up. And quite a lot of pharmacies are starting to do that, and I think it's a really useful service. We will, throughout this time, maintain we will do our best to make sure that we communicate with you more effectively, so you know what's going on, and so you're not having to contact us to find out what's happening with your prescriptions.
So we have another question from Sonia Van. How can local volunteer community groups support HGH?
So I think that's a great question, and I think one of the things I'm learning during this is worrying times for all of us. Our patients, our staff, just because of the fast-paced things that are happening. And actually on a daily basis, when you watch the news and you hear about the numbers of people affected or impacted by this, it does cause worries for us, any of us, about our families and our friends and what's happening. Equally more so are the people who are going to be in the vulnerable group, who are being told to either self-isolate, the word quarantine is being used, and even the word shielding is being used, so to shield themselves or protect themselves from going out and doing these things. I think they will need our support, even more so. Imagine being told that you can't go out for a period of 3 months. What do? It almost changes completely your whole way of living and the way you've done things for years, and therefore they will need support. I would say, Sonia, if volunteer groups can identify themselves to us, so email into our practice, to the website, communicate with us, so we know who you are. As we identify these patients, we'd love to put details down. of what's available out there and see if there's any way we can safely connect people to what services are available. We are going together. I think one of the things in here is about the community spirit. We are part of this community here. People are going to have to pull together. This is not a problem that's going to just fix itself in days. And therefore, any help we can do to help each other to get through this, I think will be gratefully received. So please let us know of services that you have, groups that can help, and we'll make sure we connect people.
Okay, we have a question from Liza O'Neill. Are the chemists aware of post-dated prescriptions?
If they're not aware yet, they will be, and we're going to communicate with them very shortly. We are working with them. So I think one of the things that's challenging at the moment in all settings is in our practices, in our pharmacies, in all services, there are people impacted by either being unwell or they're in a vulnerable group and they need to self-isolate or quarantine and shield, and therefore these services are now working with smaller numbers of staff. And I think the challenge is just expectations that a normal service will run as well as it can do. Honestly, it's challenging to do that. People are trying to do as best they can, work remotely. So sometimes the pharmacy lead times are a bit longer than they need to be. Well, we are communicating with our partners in the pharmacies to make sure the process is as slick as possible, that we're not causing delays in prescriptions going to them, but equally they know, or sending them more work than needed, or asking them to do more than is needed at the moment. And this is why I try and ask people to maintain a sense of, let's try and stick to the routine way of ordering prescriptions as much as we can, because that will mean that we can actually plan for these services and balance them out.
Pharmacies are aware of post-dated prescriptions because it is something that we have done occasionally in the past where it's been appropriate to do so. But what they won't be familiar with is the volume of post-dated prescriptions that are now likely to be coming through. The issue with a post-dated prescription, as I understand it from the pharmacy perspective, is that they are unable to pull it down from the spine until the date that the prescription is dated from. So that's why I'm saying we are trying to send messages directly to our patients, but also to the pharmacist to let them know, because unlike in the past when it was a piece of paper and they had the piece of paper on file, they won't actually be able to access the electronic prescription until the date, so they won't necessarily be aware that it is there waiting for the individual.
And that's why there's a bit of a change in process. We need to work closely with our patients and the pharmacies to do this. I know Sonia has asked for an email address. Sonia, I would ask you to use our website. Our website has a form on it. If you send us details, that form will be directed to the right people in the practice team who will pick that up and contact you. So if you give us your details via our website, we'll be back in touch. But great offer, and thank you very much for that.
There's no questions from patients at the moment, but one from me. What might the next few weeks look like for our patients?
So I think so I'll break into two parts. One is probably for our patients, and then probably for us as a practice as well. Because I think it's worth our patients understanding that some of the challenges and some of the things we're having to do in the background. And I know, John, you and the team are having to work really hard to maintain that, because it's suddenly overnight a new way of working, which we're implementing. I think there'll be more patients out there who will need to self-isolate, who might be in the vulnerable list, and therefore they may not be able to do what they routinely do and go out and attend appointments or be able to do what they normally did in their day-to-day lives. And that is really important. The reason why it's important is because we're trying to control the spread of this virus. Delay it as much as possible, and actually by controlling the spread of it, actually we may be able to manage the health service system better. So it is really important that patients do listen to instructions or directions about the way of the things that we're asking them to do. So either that may be please don't attend the surgery in person, try and contact us remotely, use our website, use other means by telephone, but please don't visit the practice. And more and more of that will be enforced, because we are still each day getting people attending the practice where actually it's not appropriate for them to do so. Anybody with a temperature, a cough, actually should not be attending surgery. They should be contacting us either by phone or through our website, and using that as a way to do these things. We've accepted that not everybody is aware of that, and therefore I think we've been slightly more relaxed in accepting that. People who have been to practice will know that we have a system in place where temperature, we have a team at the front door. There is only one door coming to practice. All people are triaged at that point and checked for any symptoms, temperature or anything else at all, and if appropriate sent into a quarantined area or sent back home to contact us.
At the moment, the only people we are allowing into the building are those that have a pre-booked appointment. So these individuals will have been screened already, either on the phone or through text messages that we will have sent out to make sure they haven't got a fever and they haven't got a new onset cough, anything that would lead us to be concerned about the possibility of coronavirus. Our aim in doing this is to try and maintain the surgery as a safe site so that the vulnerable patients who do need to be coming in for their blood tests or their reviews are able to do so with confidence that we are trying to keep the surgery safe and as infection free as it is possible for us to do so in terms of risk management. That's why we are, if people are turning up and they haven't got an appointment, we are sending them away in order that they can submit their request online, or if they haven't got online access, then through the phone, and we can then assess the appropriateness of whether they need to come and be assessed physically, face-to-face at the surgery. Now, that's the situation as it stands at the moment. We are responding to updates as they come through. I can't say that that is going to be the same situation 2 weeks from now, because we do not know how this infection is going to impact the NHS as a whole, and what we as primary care are going to be asked to take on board and deliver for the safety of our patients and the community. But as things change, we will do our best to keep people informed, and if we need to start seeing patients who are at risk, then our plan would be to still try to maintain safe areas for patients who do not have symptoms, and designate a separate entrance and separate access and separate facilities for individuals where there might be a risk. So please be assured we are trying to plan ahead in anticipation of what we feel may be expected of us in the future.
So one other thing just to add to that, I think it's pretty important. At this moment in time, we're trying to maintain as much of the routine care as we can. And people will have seen this in hospitals and other places. We may come to a point when actually the workload from looking after patients who may have the virus or are vulnerable is the priority. Thereby we have to delay or postpone some of the routine things we were doing until such a point when actually we can stand things back up again. So I think it's worth people being aware. It won't be a choice that we will have taken lightly, and it won't be a choice that only we as a practice are doing, but it will be the national precedent that actually we may be asked to stand down some of the routine stuff. And so people may see that, and that may be for several reasons. One is that actually it's not safe for patients to be coming out, visiting practices, unless there's an absolute essential reason you need to do so. The second reason, and I think it's really important for patients to understand, is that we equally have people in the building, our staff, who may be impacted, and we may not have the staff to be able to continue with some of those routine care because they're impacted or unwell as a result of the virus. I think it's important that you bear with us. What we promise to do during all this time is to maintain a good level of communication with you so you're aware of what's going on.
We have a question from John Wyatt. What is the procedure now for routine bloods?
So again, at the moment, the main thing, John, in this scenario is that we will ideally we will check with you to make sure that you haven't got anything. You're not in a group who's either got a temperature, a cough, or have been in contact with somebody, and so you're not self-isolating. So on that basis, and because we want to maintain as much of the routine care, we don't want our routine care patients to become unwell. Okay, so we're trying to carry on with this. But we do ask that you do not attend the surgery if you're in the group where you've either been unwell, because actually the last thing you want you to do is both attend the surgery and make other patients who are here unwell, or even the staff. But if you have got, if none of those things affect you, then for as long as possible we'll continue to offer routine blood tests. but we will screen you for that test before you invite you to the appointment.
Okay, question from me. Lots of other organisations are having their staff being sent home and potentially working from home. How are Hall Green Health dealing with the pressures in that respect?
So I'll start, and Dr. Cartman can give an example of having seen the impact of some of this. So we're doing our best. I think we're thankfully at Hall Green Health we're in a slightly better position than quite a lot of other places where we do have the infrastructure, the equipment and things to be able to get staff to work remotely from home. Now sometimes it sounds really easy. It's great. I've got the laptop and I can work remotely from home. If you're not well, or if you've got children running around behind you, it may not be the easiest thing to do to carry on doing routine work. And that's so we're not only doing it for our clinicians, but we're doing it for our non-clinical teams, because we want to, as much as possible, maintain offering the services, continue to offer the service in the same way as we can. It would definitely be impacted. We may not be able to do all the things we were able to do while we practice, but at the moment we are working with staff to make sure that if they do have to work at home, they've both got the equipment to access our systems, but also to communicate with patients from home.
I think that's the ideal that we are working towards. But anybody who uses IT knows that sometimes it doesn't work as we might wish it to do, and so as we have to move more and more to the majority of our team working remotely, I would ask that people bear with us, because it's likely that from time to time individual clinicians may well have difficulties, and we will have a team trying to help us overcome those. But of course, if we're remote in our own homes, that becomes much more difficult to resolve in a timely manner. We will always do our best to respond to patients who have pre-booked video consultations or telephone consultations with us, but it's highly likely that they won't necessarily run absolutely to schedule. So I would ask people to bear with us as we get used to the technology and the challenges that brings.
That's a really good point. And can I thank all the people who are sending us their well wishes and thanks for continuing to maintain a good service. Again, we really appreciate all your support as well. Just building upon Dr. Cartmill's points, we will try our best always to provide provide good access for you to get the advice and reassurances and help you need, plus continue. We will try and in many cases make sure that the clinician knows you well is the one that's phoning you or doing the video consultation with you or providing the advice back to you. That may not always be possible if they're unwell or something else occurs, but on the whole we will do our best to make sure that's the case. That makes all the difference. Bear with us. I know, in terms of people ringing back at a specific time. Same as when you're here in the building, we cannot predict how long a consultation will take on the phone or video, so we may be running late. You may suddenly have something that's slightly more urgent that comes in that we have to deal with immediately, therefore that's slightly delayed. So I would just ask, we will, give us that opportunity to make sure you do get back in touch. If you haven't been in touch within 20 minutes, by ringing the surgery won't probably help any of us at all. So there's a bit of that. But equally, if you haven't been able to do what we should do, please let us know, because actually we're always looking to ways to make sure the service works really well. That's something we're doing isn't having a negative impact, but just because actually our main job is to make sure that we do continue to provide the best service we can.
Okay. We have another question from Lisa O'Neill. Will the surgery be carrying out testing for COVID-19?
So the present advice on this, and the reason that testing in the community stopped, is because actually the likelihood of a lot of people in the community having COVID-19 was very high. So actually the majority of people would have the virus, same as we get during flu. Now the question is the number of tests available to do this, and a rapid test for things is not available. So the only way to get a test was to have a swab taken, and this is not a swab that you could take yourself, because it had to be a swab taken from your nose and the back of the throat, which is not the most pleasant thing to have done. But the number of laboratories in the country that could do these testing was small. What happened as a result of us trying to identify, one, we need to monitor the progression of coronavirus and know exactly who's affected by it, is that actually at the moment it's being those tests are being prioritised with people who are being admitted to hospital with severe infection. Okay, so we know actually exactly who are positive and the fact they need to be treated and actually monitored. The next group who are now being identified for this, and this is because we are starting to have people, especially in the healthcare professional groups, who need to provide care, is we were getting people who are part of a household where a child has become unwell, a spouse has become unwell, and as a result the clinician or anybody else who works in the practice is now having to self-isolate or be quarantined along with that family for 14 days. That has a negative impact on us being able to deliver the care for you. So the next group who are being prioritised to look at having testing done are the healthcare professionals. This is as we ramp up to having a much simpler test to be able to identify this. A lot of people around the country, and around the world in fact, are working on the quickest way to do the simplest test to be able to give us a yes or no answer. So at the moment, there isn't any routine testing at the surgery for COVID-19. It isn't available. Only those who get admitted to hospital and need that testing are the ones who will have it. There may come a time in the coming months where that becomes available, and if you have the symptoms and it's appropriate, then as a practice we will look at how we do that. But there isn't anything at the moment that is available to us as a practice where you can have a routine test of the practice for COVID-19.
We have a question from Amy Power. We may have touched on this already. Just to reiterate, how do patients get their prescriptions?
So, Amy, coming back to again, if you've got if you're a patient with a long-term condition who is on regular repeat medication, then I would say that actually, hopefully you may have login details for an online account. Please use that to order your prescriptions. If you haven't got a login account, please contact us through the website. We can help you create one for you, and that's still the best way to order a prescription from the practice. Because actually, you put the request in from the workflow of the clinician, the practice. They look at it; it's all appropriate. They authorise it, and it goes straight to the pharmacy that you've nominated. So please make sure you've nominated a pharmacy that you go to, and it will go straight to the pharmacy where you can collect it. And on the system, you can see at the point where you requested it, and you can see at the point where it tells you that the prescription's been done by the practice. So you can monitor all of this without having to contact the practice. Hopefully it makes your life easy. If you haven't got that, please contact us through the website, and we can look at actually how we can set that up for you. If you haven't got access to the internet or any of the practice, you drop a prescription request off. Again, that means coming to the practice, and I'd encourage people not to have to come to the practice. But if you have no other means, then please drop a prescription request off at the front of the practice.
Okay. Dr. Cartmill, there's a question from Leslie Ingley regarding blood tests again. So what she's asked is, she needs to come in for a blood test for diabetes. Does she just turn up, or does she need to book?
At the moment, I'm not entirely certain exactly what we're doing with that in terms of whether we're still running our walk-in blood system or whether we're going to be moving to appointments. As things stand at this precise moment, I'm advised we are still running our walk-in bloods. So people who wish to have a blood test can request via the website that they want to have the blood test, and they will be screened. But please don't come to the walk-in bloods clinic if you have symptoms that could be suggestive of COVID-19, or if you are currently in self-isolation.
Yeah. That's probably the key thing. We are doing our best at the moment to maintain a routine service, recognising that we don't want our well, but please, if you are unwell, contact us and we can screen you and tell you when it's appropriate. Maybe that actually we delay things for a few months. If we've sent a letter out to you asking you to attend, again, that was sent at the time, and things are changing on a daily basis, when actually it was fine for us to do so. We may have to stand some of these things down, but if you do, we will make sure we communicate with you.
I would say obviously we're trying to maintain the service, but we're also relying on having sufficient staff to be able to provide the service. So whereas we were running 2 sessions a day, most days, we can't guarantee that will be the case going forward, and that's why I'm saying I'm not absolutely sure, because it's going to depend on our staff availability as well as the restrictions put upon us as this pandemic escalates, and we need to respond in an appropriate manner. But at the moment, it's still running.
So a lot of Hall Green Health appointments at the moment are happening over the telephone, as you mentioned. Could you explain a little bit how video consultations work for patients, please?
Yeah. So I have a start and hand it to Dr. Cartmel first. So it's one of those scenarios where actually people think, well, actually, why do you need to do video? Telephone seems to work okay. But amazingly, we've had some good examples. So let me explain the service, and then let me explain why it may be useful for us to do this. So one is that actually we now have an opportunity for a tool which literally at the point we can send you a text message with a link in it, and using your smartphone and us using our smartphone from our side, we can suddenly connect, very similar to FaceTime and Skype and WhatsApp videos. So, but instead of having that connection where you have somebody else's number, we can send you an invite. You click on it, it opens an application up, and actually you can configure you can see us on video, we can see you, and so that's the functionality we're using at this moment in time. And they may be that actually instead of phoning you, we feel that's a better way to communicate with you. Technology should be very straightforward to use, and as I said, it's what we've gone for, rather than something more complicated and you having to be part of an app that you have to sign up to, which may change in the longer term. That it will be that the connection will be made. We will still ask you the same questions. We'll ask you to confirm your identity, your name, your date of birth, and first line of address, same as we would do on the phone. It's really important we have that. But this is our alternative to you sitting in front of us and us being able to look at you and go, actually, this patient looks well or doesn't look well. We've had a few scenarios where, and the clinicians have given us good examples, where children sound really unwell based on the description we've been given about them. And then you suddenly do the video consultation, and actually it's really reassuring to see that child running around with a device, being played with a drink in their hand. That gives you a completely different picture to what you would have gained based on just that telephone call. And that's why it's really important. Equally, in some cases, a simple rash that actually we may have had to bring you up for, and it's not always easy to see these on the phone, but in some cases we can look at it, and I know Dr. Cartmel is very good at looking at rashes, but we'll say, actually, that's a very classic case of eczema, or it's a very simple reaction to something. That stops us having to bring you into the surgery. So that's where video becomes really powerful and really helpful. May not be for everybody, and so therefore in some cases telephone is more than enough, and people are comfortable with that. But where we can use it, I think just being able to see somebody, seeing each other, and I think as we move into a period where we may be self-isolating and not seeing many people, just being able to talk to somebody by video helps. I don't know if you're experienced, Dr. Cartmel.
I have to admit, I haven't used video consultation yet, but I fully intend to do so. I have got used to consulting over the phone, but nonetheless there have been some instances where it would have been really helpful to be able to see the individual in order to really feel that I've done as full an assessment as I could and ensure patient safety and that my diagnosis was correct. So for me, there will be some consultations where I feel video is useful, but for patients, I know that even when I've been comfortable with a telephone consultation and felt that it addresses everything I need to address, I know that individuals consulting with me have felt that they are missing out to some extent and value the direct face-to-face contact that we seem to be moving away from and of necessity are having to move away from now. And so for those individuals who would prefer a video consultation rather than telephone consultation, then again, when they are requesting from the surgery that contact either through an online appointment request form or on the telephone, if they really feel they wish to have a video consultation, then if they let us know that from the outset, then we can try and make sure we've got everything that we need in place in order to deliver that video consultation. And I think that's really going to help individuals feel that they still have that personal contact. If the video consultation isn't sufficient or the telephone consultation isn't sufficient for us to make a safe diagnosis, then we will bring people in if we need to. But we will also be trying wherever possible not to do that. And so there may be some instances where we will offer a treatment as a trial to see if it does make a difference to the rash or whatever symptom the person has. And that's not unusual. We would have done that perhaps in the past anyway if we weren't absolutely sure it is a try this, see if it makes a difference. If not, let us know. So we're not doing anything tremendously different. It's just the circumstances in which we are doing it feel very different to how they used to be.
Thank you for that. And I think it is important to say that actually it is a bit of a learning curve for all of us. So telephone we've got familiar with, and it took our patients a while to get familiar with. And comfortable with telephone consultations. It's just something else we're moving into. Hopefully people do this in other aspects of their lives, and they communicate with family and friends. We're not using technology that's very different to that. This is just something that you didn't think you'd be able to be doing, is talking to your doctor by video. But maybe actually it is appropriate. So we've got another question on here. So Jill, thank you for your question. The question is that you've got blood tests booked next week, a diabetes review, and actually one of the questions you've got on this is do I still come for my blood test, and then I come for my routine appointment? So I would say, Jill, at this moment in time, I'm really keen. One, please don't worry about the DNA bit. We understand people may be self-isolating, but in the first instance I would encourage you to come along and have your blood test done, because they will give you a lot of information about how your diabetes has been progressing over the last few months. But instead of making you come back for a review face-to-face with the nurse, because we will actually then make that either you can choose a telephone consultation or a video consultation, just so you can have that review, for you not to miss out on any opportunity to have that routine care if possible, because actually it's really important for you to know what to do with your diabetes for the next 6 months if possible. Okay.
So we have a question from Mina Mystery. What happened to people having their regular injections for B12, etc.?
So again, in these things, Mina, we were keen not to stop that, because actually not having your regular treatment, if it has a negative impact and makes you feel makes you unwell, is not what we want at all. So as long as you are not self-isolating, don't have a temperature, don't have a persistent cough, and if you do have any of those, there's maybe a period of 2 weeks where you can't attend us, but after that it might be completely safe. So we will just ask that you postpone those things until a point you're well. If you don't have any of those, we will do our best to get you in and make sure you can have that injection on time.
Great. John Myats has commented just to say that video consultation is an excellent way forward, given the current circumstances. And then there's been a question from, otherwise I think it's now been removed, from Richard Notwell.
Yes.
I have monthly Simponi injection for arthritis. I think it's anti-TNF drug. Do I need to do anything about COVID-19?
So I think in this case, and I think Richard's just describing a scenario of having a treatment, and actually some of these treatments affect our immunity and make us more vulnerable. So Richard, what I would say, and this is why it's been coordinated centrally by the Chief Medical Officer for the NHS, for Health and Care, they are looking at the list of patients who might be slightly more vulnerable and therefore need to protect themselves. Equally, it's really important you get to have your treatment, but we need to make sure you have your treatment in a safe environment. So all people who might be in a vulnerable group are going to be contacted by early next week, and arrangements made for them to receive their care in a particular way. We're just getting more details on how that's going to work out, but I would say at this moment in time you'd expect to continue to receive your treatment unless you're told otherwise.
Okay, next question from myself. A lot of patients are obviously struggling to get through on the phone at the moment. We know the practice is having in excess of 800-900 calls a day.
Yeah.
What is the best way to contact the practice?
So I think that, and again, we just need to probably understand the reasons why people are trying to contact us, which is why we're trying to use this medium and communication. If it's because you're worried about something, we have tried to make sure our website is always up to date. Okay? If it's something about coronavirus, our best website to go on to the www.nhs.uk website, which has all the links and the latest information about what to do with coronavirus, what's happening, what self-isolation means, any of these, and it has the latest information which is being issued on a daily basis, and things do change. Something I tell you today may be different tomorrow, but the government has committed to making sure, and the Health Service, NHS England, to making sure that our website is up to date minute by minute with the latest guide.
So if a patient wanted an appointment, for example, would you advise them to call through? If so, what time? And if not, how else could they contact us in that respect?
So we have traditionally always, as patients and the public, said ring a GP surgery at 8:30 in the morning. Everybody ring, and so our phone lines in the morning are extremely busy. So what I ask you to is that there are several ways, and actually, if you do need to make a ring us and know the means to contact us, then please do continue with that. But we have significantly improved the way we've done things over the last several years, to our website being able to be the way to be able to contact us. And our website has a facility for you to be able to answer a question. So if it's something more routine, even something urgent, we have staff on and a process in place at the practice that if you contact us with your query, we will process it very quickly. We will hand the query. If it's a clinical inquiry, we will hand that to a clinician to look at and respond to you. If it's a non-clinical thing, we have our non-clinical team who will look at it and respond to you very quickly. It is 6 ways to get a response. Okay, so I would ask people to try and use that. If you do that, then you will help free up the phone lines for people who might be slightly more vulnerable, who haven't got it, who need to contact us, so we can help them. So I would ask if people can use our website to contact us and ask us questions, and we will respond to you.
Okay, great.
The online appointment request form that is accessible via our website, I'm aware that it says on it that you acknowledge that your request is not urgent, and we give ourselves a time frame in which to respond. At the moment, what we are doing is, if we are seeing those requests come through in the morning, we are endeavouring to have looked at all of those requests by the end of the morning, and similarly the ones that come through in the afternoon. So they are looked at and they are then acted upon on the advice of the clinician. So don't be afraid to contact us through the online appointment request form that's on the website. It's a very time efficient way of dealing with it, and actually the more information that you can give us on that form, the better. Because that then allows us to assess who you need to see and how urgently you need to see them, and put that in place for you. And in some cases, we have responded within an hour or two of that request coming in, and actually that's then caught the individual out because they weren't actually really expecting to be contacted quite so quickly. So please use that, and we are using that more and more now. And so if the phones are busy, you may well find that that's a much quicker and time efficient way for you to get through to the practice and have your appointment or query dealt with.
So I think, just building on that point, if you do contact us, then please keep your phones on and things on, so you and be ready for us to contact you at short notice. Because sometimes what we do is we see the response, and then we arrange for a clinician to ring you. It is a challenge to have to keep ringing people back over and over again to try and contact them. So if you have contacted us, please be ready for us to contact you. Equally, we will try and make sure if it's something more routine that we schedule, letting you know that we're going to contact you or talk to you, which is critical. I think the last thing, and this is the bit about the information you give us really helps us to make sure that the right person contacts you. Okay, so maybe that actually your query is more routine. You need to wait for a doctor who knows you well, for them to be the one that contacts you back in 2 days' time, than somebody who doesn't know you to contact you the same day. Because that makes all the difference. So the information you provide helps us make that assessment. Okay.
So we've got a question from Lisa O'Neill. Are rheumatoid arthritis, type 1 diabetic and Crohn's disease classed as high risk patients?
So we're going to have to wait until the guidance is issued, just because at the moment, if you use the criteria for high risk as our flu population, then for practice our size it's almost 9,000 patients. Nationally it's 15 million patients. That's a huge number. So the scientists, health advisors nationally are working really hard, closely together, to identify the patients who are at the most risk from coronavirus, and that list has been generated, and they will be issuing us some guidance. I would expect that actually there will be some of those groups who will be in that, but we just need to wait and have the final confirmation of what that guidance is.
Okay. Next question is from Sabiha Aziz. It looks like she's having issues getting her son's meds from nominated pharmacy as they didn't have the new fax number. Has the new fax number been sent to everyone who needs it now?
I'm not sure about the fax number at all, which is one of the reasons I'm just. So I just need to understand. So Sylvia, if you contact us directly through the website and let us have the details of that, we're really keen to look at that. Really keen to make sure your son's pharmacy are communicated regularly. I just need to make sure we're not talking at cross purposes about the hospital sending a prescription to us sending a prescription to that pharmacy. I know that actually in some scenarios it is the only way. Let's have details of that, and if it's a practice communication to the pharmacy that's not working well, we can look to fix that.
I believe one of the administrators has pasted the link for you to contact us via the website. The next question is from Glenda Harris, and this might be a similar answer to the one you gave earlier. I'm 70 years old and I've got COPD. Do I need to isolate? I get a chest. I think that means I've got a chest infection as well.
So Glenda, again, it's difficult. So I think the government guidance that came out, and things are changing on a daily basis. So the groups that they said were at risk in the early Chief Medical Officer's guidance this week identified patients who were over the age of 70, pregnant, or in a vulnerable group. And the vulnerable group included people with things like diabetes, COPD, severe heart conditions. So ideally what it says to you is be careful, okay? Be careful about going out more than you need to. In this instance, ideally use any opportunity to not have to do that, because you are slightly more vulnerable than the wider population to picking up this virus. None of us know who we come into contact with when we're out who may have this. So I would say to you, Glenda, caution is probably what's advisable in your case, especially because you fit two of the criteria, both age-wise and the vulnerable group. So anything you can do where you don't have to go out and other people can help you, I would take advantage of.
Okay, so that's the end of the questions. Is there any more general advice you have for our patients before we start wrapping this up?
So I think I would just ask our patients to let us know if any communication that we're issuing doesn't make sense, confusing, because we're doing our best and actually we may not always get it right, but equally tell us the best ways to communicate with them. Because this is we've had a various number of people join, and it's been great that people have been able to do that. Really grateful people who made the time. If people feel this is an effective way of doing this, and actually today the numbers are such because of the suddenly changing from a face-to-face to a virtual session, we can do this again, not leaving it 2 months but sooner. If they find there's confusion about the criteria, we can use this. Equally, if our text messages and the links to our website or links to other pages don't make sense, tell us about what we could do. But I would ask that actually people keep up to date with the guidance on what's happening, and it is changing on a daily basis. And help us if there's anything obvious that doesn't make sense at all. Please, if you do need to contact us, use the website. That's probably still the best way to do it. If that doesn't work, contact us by telephone. If you're not certain, do contact us. Don't just turn up for the practice. I think otherwise, it will almost certainly be sending you home to be communicated the other way, and we don't want you to have a wasted journey and be frustrated by the process. I can see there's a quick question that's come up on here, which is about a telephone appointment and for a face-to-face afterwards. So because Simon, things have changed quickly in the space of time, the advice we were giving and what we were planning to do a few weeks ago, I spent most of Saturday last week. Most of the patients I needed to see again, none of them have been booked for a face-to-face appointment. But that's because as of Saturday I knew what was coming, whereas a few weeks ago I would have booked them for a face-to-face appointment for a follow-up. I am now booking them almost certainly for a face-to-face or a video, whichever they choose, and communicating with them and saying to them, look, unless you need to see me for 6 months, we don't need to see each other again for 6 months. And I'll make sure your prescriptions are sorted. So that's why at that time you may have been asked to book for a face-to-face. We will ask the clinicians who booked you in whether or not they feel they can communicate with you by telephone or video and convert that into one of those consultations rather than making you come. Please bear with us, okay? Please bear with the staff. They're doing their best. There's an increased amount of activity. It is frustrating. We will do our best to always communicate with you. We'll always continue to do our best to help you. We're doing that. please look out for each other, look after your families, look after elderly neighbours and people nearby. Really important, because actually people will be worried, and I think that if we can do some of those things, we'll probably be able to get through this crisis in the safest and best way possible.
Can I just build on what Dr. Nazir said about contacting us if you've any concerns? Of course we want you to contact us if we are the most appropriate people to answer your question or your concern. Please don't reflexively contact us with queries that you can potentially have answered elsewhere. Please, as Dr. Zir has said, if it's anything to do with coronavirus, please use the NHS 111 website, because that's where the up-to-date information is. Please, if you've got other queries, consider if it's an eye problem, you go to the Minor Eye Conditions Service. You can look up the nearest one online. If it's a query about medications or something else, minor ailments, then it may be more appropriate for you to go and speak to your local pharmacist. We have an unprecedented escalation in the number of contacts through to the surgery, and our staff are working tremendously hard to handle the call. It's going to become more and more challenging as we lose staff because of illness or quarantine, even with remote working. So I would please ask that by all means approach us, but please also be sensible, because if we are dealing with queries that other people could deal with, that's preventing us from dealing with the queries that perhaps we're the only people who can answer those questions. So I'd ask everybody to think, but please do contact us if we're the right people to answer the question.
So just building upon that, there's one about sick notes. I suppose I should have. Sick notes is a common one. So people who are having to self-isolate and work, or somebody else is asking them for a confirmation of that. The practice has no role in that. That has been coordinated centrally. The NHS.uk website is still the best place to go. That will link you to the NHS 101 online website, where you'll answer some questions, at the end of which it will generate you a note and whatever you need to confirm to work or anybody else that you're in self-isolation. That process is nothing to do with the practice. So then by contacting us, all we're doing is directing you back to that. We will communicate that out. So it's really important. Having said that, people who are on sick notes for other reasons, please contact us through the website. Still the best way to do it, and we'll process that. Thank you to everybody for their well wishes about the first episode of GPs Behind Closed Doors. It was great to showcase all the hard work that goes into practice, and also showcase our lovely patients, which is just as important, who made made that episode. So thank you for all the support with that, really important. Mahbub just asking about steam inhalation. Steam inhalation, if you've known me for the last 20 years, I've been a GP here, is one of my favourite pieces of advice, along with squash, to keep yourself hydrated. Again, it's difficult. With common coughs and colds, steam inhalation does help, but if it's not getting you better, then do contact us and we'll give you more advice. But of course, there's nothing wrong with old remedies and keeping yourself hydrated.
As well.
So again, it's good to share these things that help. Is that okay? And
so there's no final questions at the moment. So any last words before we say goodbye? For now.
For now. So thank you, and thank you for joining, and thank you for bearing with us, and thank you for your ongoing support for us, the staff, and for the NHS, because actually for us to be able to tackle this, we are going to have to pull together. So and thank you in advance for doing that. And we will continue to do our best for you. So, okay. Thank you, everybody.
Thank you.